Nasogastric tube insertion is a common procedure in the hospital setting. It is a useful technique for doctors and nurses to know and be able to perform. This DVD will demonstrate and explain the insertion of a nasogastric tube, as well as the anatomy of the gastro-intestinal tract in relation to this procedure. This is a nasogastric tube. They are commonly made from polyurethane or silicone, as these materials are resistant to gastric acid. The tube is radio-opaque, which means it can be visualized on X-rays. You will see why this is useful later on. You can observe free flow through the tube in this demonstration. We can aspirate stomach contents using a syringe. Next, we need to measure the length of tube we will require to insert through the nose to reach the stomach. This can be conveniently estimated by using the tube to measure the distance from the tip of the nose to the earlobe, plus that from the earlobe to the transpyloric plane. Pass the tube calmly and slowly along the floor of the nose and into the nasopharynx. Stop if your patient is very uncomfortable or asks you to. It is a good idea to keep looking at the patient's face during the procedure to check they are coping adequately, or perhaps agree a sign if they are distressed. Once in the oropharynx, it continues its journey into the esophagus. The patient taking sips of water not only helps us to pass the tube more easily, but it also triggers the swallowing reflex to close the epiglottis and prevent passage of the tube into the trachea.